Hello and welcome to a pivotal discussion on a deeply important and sensitive topic, ancient herbs for modern cancer care. In this new series, we will explore specific botanical allies from traditional Chinese medicine that have historically, and in some cases, continue to be, utilized in the complex landscape of cancer treatment. It is absolutely crucial, from the outset, to establish a foundational understanding. The information shared here is strictly for educational purposes. It is not, under any circumstances, intended as medical advice, a diagnosis, or a substitute for conventional cancer treatment provided by qualified healthcare professionals. The herbs we will discuss today are powerful substances. Some possess notable toxicity and require immense caution. Their use in any context, especially related to serious conditions like cancer, demands the direct supervision and guidance of a licensed and experienced healthcare practitioner. Self-medication with these herbs is highly discouraged and can be extremely dangerous. With this vital understanding firmly in mind, let us respectfully delve into the profound historical and contemporary applications of these remarkable plants. This is Nature's Final Frontier, Ancient Herbs for Modern Cancer Care, Part 1. Our first powerful ally in this exploration is Oldenlandia, known in Chinese as Bai Hua Shishikao. This evocative name translates to white flower snake-tongue grass, perhaps referencing the shape of its leaves or flowers. This herb is derived from the entire plant of Oldenlandia diffusa, or its close relative, O. corymbosa, both members of the Rubiaceae family. These plants flourish primarily in the southern Chinese provinces of Fujian, Guangdong, and Guangxi. They are typically collected during the summer or autumn months, then carefully cleaned, cut into pieces, dried, and used in their unprocessed form, preserving their inherent medicinal properties. Historically, Oldenlandia was highly valued as a febrifugal, meaning it helps reduce fever and a general detoxicant herb. Its traditional applications primarily focused on alleviating damp heat conditions, which in traditional Chinese medicine TCM refer to a pathological state characterized by both excessive heat and fluid accumulation, leading to inflammation and infection. It was also used for pyogenic, pus-forming infections and to address difficult urination. However, in more contemporary TCM practice, Oldenlandia's role has expanded significantly, with a prominent emphasis on its documented antitumor properties. In current traditional practice, Oldenlandia is frequently prescribed as an antitumor agent for various types of cancers, including colon, stomach, and esophageal cancers. It is often used in a decoction, either alone or in synergistic combination with other herbs, such as sophora root, to enhance its efficacy. Beyond its direct anti-cancer applications, Oldenlandia is still highly valued for its ability to eliminate heat toxins and generally detoxify the body. This broader detoxicant action extends its use to treating conditions like coughs, sore throat, and tonsillitis, where heat and toxicity contribute to inflammation. Furthermore, it is a key herb for clearing heat and eliminating dampness. This makes it an important component in formulas for treating carbuncles and boils, often used both internally in a decoction and externally applied to the affected skin areas, intestinal abscesses, and systemic conditions like jaundice, where it helps eliminate dampness and heat, contributing to liver dysfunction. Its diuretic action also makes it valuable for urinary tract infections, edema, swelling due to fluid retention, and strangury, painful, difficult urination. From a modern scientific perspective, analysis has revealed that Oldenlandia contains a variety of active chemical constituents. These include iridoid glycosides and specific compounds named oldenlandosides A and B. It also contains plant sterols such as stigmasterol and beta-sitosterol, the triterpene olenolic acid, and other compounds like sitosterol D-glucoside, p-coumaric acid, and various flavonoid glycosides. This complex blend of compounds is believed to contribute to its diverse and powerful therapeutic effects. Pharmacological research has provided strong evidence supporting many of Oldenlandia's traditional uses. 1. It is indeed confirmed to possess antitumor, antimicrobial, and anti-inflammatory properties. These findings align directly with its historical use for infections and its contemporary role in cancer support. 2. Beyond these, it has also been shown to be analgesic, pain-relieving, sedative, and even hypnotic, sleep-inducing, suggesting broader systemic effects on the body's comfort and relaxation. 3. Perhaps one of its most significant findings relates to its impact on the immune system. Oral administration of the herb's extract has been shown to increase the phagocytic capacity of peritoneal leukocytes against Staphylococcus albus. Similarly, a decoction given orally to rabbits resulted in a threefold increase in the phagocytic activity of their leukocytes. Furthermore, the herb also increased the phagocytosis of Staphylococcus aureus by human leukocytes in vitro. These compelling results indicate that Oldenlandia actively enhances nonspecific immunological activity, meaning it boosts the body's general, innate ability to identify and engulf harmful pathogens and cellular debris, thereby strengthening overall immunity. For typical therapeutic use, Oldenlandia is most commonly prepared as a decoction, a concentrated liquid extract. The recommended dosage for a decoction is relatively broad, ranging from 15 to 60 grams. For external use, the quantity can be adjusted as needed. A crucial and explicit warning. Due to its cold, energetic nature, people with cold conditions e.g., poor circulation, cold extremities, stomach and spleen deficiency, which might manifest as chronic digestive issues like loose stools or poor appetite, and pregnant women should generally avoid this herb or use it with extreme caution and only under professional guidance. According to some traditional Chinese materia medica texts, this herb is considered non-toxic at suggested doses. However, toxicity studies have shown that the LD50, lethal dose 50%, the dose at which 50% of tested animals die of the extract of the herb by intraperitoneal administration in mice, was quite high at 104 g/kg, suggesting a relatively low acute toxicity in animal models. Nevertheless, given its potent effects, professional oversight is always paramount. Our second powerful herb in this Herbs for Cancer series is lobelia, known in Chinese as Banbian lion. This name, meaning half-sided lotus, beautifully describes the distinctive appearance of its flowers. This herb consists of the entire plant of Lobelia chinensis Lur, belonging to the Campanulaceae family. It is widely distributed throughout many provinces of China, particularly in Anhui, Fujian, Guangdong, Guangxi, Hubei, Hunan, Jiangxi, Jiangsu, Sichuan, and Taiwan. Typically collected in the summer months, the plant is carefully cleaned, dried, and then cut into sections for medicinal use. Traditionally, lobelia was historically used as a primary remedy for severe, acute conditions such as snake and insect bites, fevers, asthma, and a specific type of fever known as ague, often associated with malaria. In contemporary traditional practice, lobelia is widely recognized for its strong anti-inflammatory effects, its ability to eliminate damp heat and act as a diuretic, and most notably, for its potent anti-tumor properties. From a traditional perspective, lobelia exerts a significant anti-tumor effect. It is specifically indicated for various digestive tract cancers, including stomach cancer, esophageal cancer, cervical cancer, and colon cancer. In these applications, lobelia is often combined in a decoction with other synergistic herbs such as scute root, scute barbata, and skullcap to enhance its anti-cancer potential. Beyond cancer, lobelia is powerfully effective at eliminating pathogenic heat and detoxifying the body. Its decoction is traditionally considered capable of removing toxic heat and directly neutralizing the toxins from poisonous snake bites, a testament to its potent detoxifying capacity. Furthermore, lobelia is used to remove pathogenic heat and dampness. This makes it a valuable ingredient for conditions like a swollen abdomen, often due to fluid retention and inflammation, where it is mixed with other diuretics. It is also combined with herbs like philodendron, bitter orange, and capillaris to treat jaundice. Externally, a concentrated decoction of lobelia can be applied to affected skin areas for conditions such as tinea, ringworm, athlete's foot, and eczema, demonstrating its topical anti-inflammatory and antifungal actions. Modern scientific investigation has identified several key active chemical constituents within lobelia. These include various alkaloids, notably lobeline, loblanine, loblanidine, and isoloblanine. It also contains loblanin and polyfructosin. These compounds are believed to be responsible for its diverse pharmacological activities. Pharmacological findings strongly support lobelia's traditional uses. It is confirmed to be a marked diuretic, promoting increased urine production and fluid elimination. It exhibits antimicrobial properties, helping to combat various infections. It has been shown to be hypotensive, lowering blood pressure, and antipyretic, reducing fever. Furthermore, it possesses both antifungal and antitumor properties, directly validating its traditional applications in these areas. Studies indicate that it not only lowers blood pressure, but also increases the production of bile, which aids in digestion and detoxification processes. For typical therapeutic use, lobelia is commonly prepared as a decoction, with a recommended dosage ranging from 15 to 30 grams. When using the fresh herb externally for conditions like snake and insect bites, it is applied directly. A critical and explicit warning. While classical Chinese materia medica broadly recorded this herb as non-toxic at very specific traditional dosages, it is imperative to understand that lobelia is a highly potent and potentially dangerous herb, especially in overdose. Certain individuals, or those who consume excessive amounts, may experience severe adverse reactions. These can include excessive salivation, nausea, vomiting, headache, diarrhea, hypertension, high blood pressure, and tachycardia, rapid heart rate. More gravely, severe overdose can lead to convulsions, paralysis of the respiratory system, and even death. Due to its narrow therapeutic window and potential for significant toxicity, lobelia must only be used under the strict supervision and precise dosage instructions of a qualified and licensed healthcare professional. People with deficiency-type edema due to weakness rather than excess heat/dampness should specifically avoid this herb. Our third powerful herb in this series is Scute barbata, known in Chinese as Banzhai lion. This name, meaning half-branched lotus, refers to the unique growth pattern of its stems. This herb consists of the entire plant of Scutellaria barbata di Don, a member of the Labiatae mint family. It is predominantly cultivated in the southern Chinese provinces of Fujian, Guangdong, Guangxi, Jiangsu, Sichuan, and Zhejiang. Typically harvested in June, the plant is carefully cleaned, cut into sections, and then dried. Alternatively, the fresh herb can also be used, particularly for external applications. Traditionally, Scute barbata has been recognized as a potent antipyretic, fever-reducing, detoxicant, diuretic, and an agent that eliminates heat dampness. Historically, it has been widely used to treat serious conditions such as chronic hepatitis, snake bites, hepatomegaly, enlarged liver, and significantly, various cancers. Its traditional applications highlight its broad capacity to clear internal heat, detoxify, and support organ health. In contemporary traditional practice, Scute barbata is a cornerstone antitumor agent. It is extensively used to treat a wide range of malignant tumors, including lung, liver, stomach, esophageal, colon, and cervical cancers. A decoction of Scute barbata is a common preparation method for these applications. For the treatment of lung cancer, it is often used in combination with other herbs such as Houttainia and Solanum lyratum, known as Bai Yang, enhancing their collective anti-cancer effects. Beyond its direct anti-cancer role, Scute barbata is also powerfully effective at eliminating heat toxins and detoxifying the body. For treating boils, carbuncles, and snake bites, the fresh juice of Scute barbata can be directly applied to the affected area. Alternatively, the dried plant can be combined with other detoxicants like dandelion, viola, and lobelia in a decoction for oral consumption, working synergistically to clear toxins from within. Furthermore, skute barbata is renowned for its ability to induce diuresis and relieve edema, fluid retention. For conditions like acute or chronic nephritis, kidney inflammation, it can be combined with other diuretics such as alisma, poria, and plantain seed to effectively relieve abdominal edema. It is also mixed with forsythia, tocoro, anemarina, and phellodendron in a decoction for the treatment of chronic nephropiolitis, inflammation of the kidney and renal pelvis. Modern scientific investigation has identified several key active chemical constituents within skute barbata. These include various flavin compounds, notably skutalarin, carthamidin, isocarthamidin, and waganin. These compounds, particularly the flavonoids, are well known for their diverse pharmacological properties, including anti-inflammatory, antioxidant, and anti-cancer effects. Pharmacological findings provide strong scientific validation for skute barbata's traditional uses. It is confirmed to be diuretic and antimicrobial, aligning with its use for fluid retention and infections. Most significantly, it exhibits proven antitumor properties, supporting its widespread use in cancer therapy. Beyond its direct actions, research has shown that the polysaccharide component of the herb actively stimulates the murine, mouse lymphocyte transformation induced by concanevalin A con. This indicates that it can enhance the proliferation and activation of lymphocytes, which are critical immune cells. Furthermore, intraperitoneal administration of the polysaccharide of the herb to mice was shown to increase the delayed type of hypersensitivity reaction to dinitrochlorobenzene. This suggests that skute barbata significantly stimulates the cellular immune system, boosting the body's specific defense mechanisms against pathogens and abnormal cells. For typical therapeutic use, skute barbata is commonly prepared as a decoction. The recommended dosage for the dried herb ranges from 15 to 30 grams. If the fresh herb is used, a higher dosage of 30 to 45 grams is typical. A crucial and explicit warning: while skute barbata is generally considered safe at suggested therapeutic doses, and classical Chinese materia medica reports no undesirable side effects or toxicity at these levels, pregnant women should use skute barbata cautiously or avoid it entirely. Its potent effects, particularly on cellular immunity, necessitate professional guidance. Our fourth powerful herb in this series is rhabdosia, known in Chinese as dongling cow. This name, meaning Eastern spirit grass, hints at its revered status. This herb consists of the dried whole plant of Rhabdosia rubescens, Hemshara, a member of the Labiatae mint family. It is primarily cultivated in the northern provinces of China. Rhabdosia is a highly valued herb recognized for its multiple therapeutic actions. It is an antipyretic, fever-reducing, a detoxicant, a blood circulation activating agent, and an anodyne pain reliever, alongside its significant role as an antitumor agent. From a traditional perspective, rhabdosia is a prominent antitumor agent and is extensively used in China for various malignant tumors. Its applications specifically include esophageal, breast, liver, stomach, lung, and thyroid cancers. It can be used as a standalone herb in a decoction or, more commonly, integrated into complex herbal formulas with other anti-cancer herbs to enhance its efficacy and address the specific patterns of the patient. Beyond its direct anti-cancer role, rhabdosia is also effective at relieving heat and detoxifying the body. This makes it a valuable remedy for common ailments such as colds, flu, fever, acute laryngitis, voice box inflammation, pharyngitis, sore throat, and bronchitis, where it is often used alone in a decoction to resolve acute inflammatory processes. Furthermore, rhabdosia possesses the ability to invigorate blood circulation and relieve pain. This makes it a useful herb for conditions like arthralgia, joint pain, swollen joints, and general body pain, where improved blood flow can reduce stagnation and alleviate discomfort. Modern scientific research has largely focused on validating rhabdosia's most prominent traditional claims. Pharmacological findings confirm rhabdosia's antimicrobial and antitumor properties. Its anti-cancer effects are particularly well documented in various studies, supporting its widespread use in traditional cancer protocols in China. For typical therapeutic use, rhabdosia is commonly prepared as a decoction, with a recommended dosage ranging from 30 to 60 grams. It can also be administered as a tincture. A crucial and explicit warning: this herb is considered potent, and therefore overdosing should be strictly avoided. As reported in classical Chinese Materia Medica and observed in clinical practice, administering this herb to cancer patients, particularly at higher doses, may cause certain side effects. These can include nausea, stomach pain, a feeling of fullness in the stomach, and diarrhea. These potential gastrointestinal discomforts highlight the need for careful dosage and professional monitoring, especially in individuals who may already be sensitive due to their condition. Our fifth powerful herb in this series is the Akebia quinata fruit, known in Chinese as Ba Yue Jia. This name literally translates to August-picked purgative, indicating its traditional harvest time and its action of clearing stagnant material. This herb is the ripe fruit of Akebia quinata, also known as Bai Mu Tong, A. trifolia, or A. trifoliata var. Australis, all belonging to the Lardisabalaceae family. It is primarily cultivated in the northern and central Chinese provinces of Anhui, Gansu, Hebei, Henan, Shanxi, Shandong, Shanxi, and Zhejiang. The fruit is collected in the late summer and then dried for medicinal use. The fruit of Akebia quinata is quite distinctive. It is typically 3 to 4 inches long, with a white, edible pulp containing black kernels. It has an agreeable sweet taste, making it one of the few medicinal herbs that is also pleasant to consume. Traditionally, the fruit was used as a general tonic, stomachic aiding digestion, and diuretic. The dried stem of the Akebia plant, often referred to simply as mu tong or by specific species names, was historically described as bitter and used as a stimulant, diaphoretic, inducing sweating, laxative, diuretic, stomachic, and vulnerary, wound-healing drug, believed to quicken all the senses and faculties. In contemporary traditional practice, this species of Akebia is primarily recognized as a chi-regulating diuretic and a significant antitumor agent. It is widely used today as a potent diuretic for various types of edema, fluid retention, urinary tract infections, and amenorrhea, absence of menstruation, especially when caused by stagnation. From a traditional perspective, Akebia quinata fruit is a key antitumor agent. It is specifically indicated for various cancers, particularly breast cancer and cancers of the digestive tract. It can be used alone in a decoction or, more commonly, combined with other antitumor herbs such as prunella, ziaku-cow, fritillaria, and patrinia in a decoction to enhance its synergistic effects. Beyond its anti-cancer role, a crucial traditional action of Akebia quinata fruit is its ability to regulate the circulation of liver chi and relieve pain. Liver chi stagnation in TCM can lead to feelings of frustration, irritability, and various types of pain. Thus, it is used for pain in the chest, hypochondrium region, upper abdomen below the ribs, and the abdomen, often combined with herbs like cyperus, bitter orange, and melia. It is also specifically combined with fennel seed, tangerine seed, and lychee seed to treat inflammation of the testes, testicular pain, and hernial pain, highlighting its specific affinity for lower abdominal and genital issues related to chi stagnation. Furthermore, Akebia quinata fruit is excellent at removing stagnation and obstruction of blood and dissolving blood stasis. This makes it an important herb for treating conditions like amenorrhea and dysmenorrhea, painful menstruation, and other symptoms caused by blood stagnation, where it can be mixed with herbs like salvia and leonurus. Lastly, it is a powerful diuretic and relieves edema. When prepared in an injectable form with alisma and prunella, it has shown good clinical results for various severe edematous conditions, including ascites caused by cirrhosis, fluid accumulation in the abdomen due to liver disease, nephrotic edema, kidney-related swelling, and cardiac edema, heart-related swelling. Modern scientific investigation has identified various active chemical constituents within Akebia quinata fruit. These include various polysugars, achebine, heterogenin, olenolic acid, other glycosides, and a significant amount of potassium salts, which likely contribute to its diuretic action. The woody part of the herb, the stem, contains triterpenes, with main ingredients such as alpha-ramirin, beta-ramirin, fridolin, and clementanocides. A and B pharmacological findings provide scientific validation for Akebia fruit's traditional uses. It is confirmed to be antimicrobial and diuretic, aligning with its use for infections and fluid elimination. Crucially, it is also confirmed to be an antitumor agent, supporting its traditional role in cancer therapy. Studies have shown that a 50% methanolic extract of the herb acts as a potent diuretic and effectively relieved experimental edema in mice, scientifically validating its traditional use for various forms of swelling. For typical therapeutic use, Akebia quinata fruit is commonly prepared as a decoction. The recommended dosage typically ranges from 9 to 15 grams. A crucial and explicit warning. Due to potential potency and historical confusion with other mutong species, Akebia stems, people with a history of kidney disorders, and the elderly should not take any species of this group of herbs, especially the stem part. It is also not recommended for use during pregnancy due to its blood-invigorating and downward-moving properties, which could potentially risk pregnancy. A critical note. The Chinese herb mutong, Akebia stem, has many species, and historical use has caused great confusion. The most commonly used traditionally were Guan mutong, Colles aristolochi manchuriensis, and Chuan mutong, Colles clematides armandea. These two specific species of the plant are highly potent, and overdose can cause severe kidney function impairments. While the fruit of Akebia quinata is generally considered safer, the caution regarding the stems highlights the absolute necessity of precise identification of the herbal material and professional guidance to avoid potential harm. Classical Chinese Materia Medica reports no undesirable side effects or toxicity at the therapeutic dose for the fruit, but the broader context of the mutong group underscores the need for caution. Our sixth and final herb for this part one of herbs for cancer is black nightshade, known in Chinese as long kui. This intriguing name, meaning dragon's heart or dragon's glory, might allude to its potent nature. This herb consists of the entire plant, including the seeds, of Solanum nigrum L., a widely distributed plant belonging to the Solanaceae nightshade family. It grows throughout China and is typically collected in the summer and autumn months. Once harvested, it is cleaned, cut into sections, and then either dried for later use or used fresh. Historically, black nightshade carries a fascinating and somewhat mysterious reputation. Ancient records suggest it had effects similar to the legendary Atropa mandragora, mandrake. Reportedly, a small quantity of its tincture could induce a profound state of anesthesia, during which operations were supposedly performed with complete freedom from pain. This led to the belief that it might have been the very drug used by the celebrated ancient Chinese surgeon Hua Tuo for certain operations, particularly on wounded intestines. While the full truth of this matter awaits more scientific investigation, it speaks to its long-recognized potent effects on pain and consciousness. In contemporary traditional practice, black nightshade is known for its ability to resolve heat, act as a diuretic, and possess antimicrobial properties, alongside its significant role as an antitumor agent. It is specifically used to treat respiratory and urinary tract infections and various types of cancers. From a traditional perspective, black nightshade serves as a powerful antitumor agent. It is used for a broad spectrum of cancers, including cervical, breast, esophageal, lung, digestive system, intestinal, and liver cancers. In these applications, black nightshade is typically used in complex herbal formulas, combined with other potent anti-cancer herbs such as Oldenlandia, Scute barbata, Duchesnea, Solanum lyratum, Bai Ying, Zedoria, and processed tortoise plastron. Beyond its direct anti-cancer role, It is also effective at eliminating heat toxins and detoxifying the body. For common ailments like colds, flu, coughs, and sore throats, black nightshade can be used alone or combined with other synergistic herbs like forsythia fruit, platycodon root, and licorice root. It is also a valuable remedy for external boils, furuncles, and other pyogenic, pus-forming infections. Furthermore, black nightshade acts as a diuretic and anti-inflammatory agent. Its diuretic action makes it useful for lowering blood pressure and treating acute infections of the urinary system. For conditions like nephritis, kidney inflammation, and prostatitis, prostate inflammation, it is prescribed with other diuretics and anti-inflammatories like alisma, akebia, plantain, and perosia leaf, shiwai. Modern scientific investigation has identified several key active chemical constituents within black nightshade. These include various alkaloids, most notably solanine, solosonine, and solomargin. It also contains various glycosides and important vitamins A and C. Pharmacological findings provide strong scientific validation for black nightshade's traditional uses. It is confirmed to possess a cortisone-like anti-inflammatory effect, suggesting a powerful action in reducing inflammation. It is also recognized as a cardiotonic, meaning it can strengthen the heart's contractions. Crucially, it is confirmed to be an antitumor agent, providing strong scientific support for its traditional use in cancer therapy. However, it is vital to note that the alkaloids, particularly solanine and solomargin, have been shown to have a hemolytic effect, meaning they can destroy red blood cells, with solomargin being even stronger in this regard than solanine. This highlights the inherent toxicity of the plant. For typical therapeutic use, black nightshade is commonly prepared as a decoction. The recommended dosage typically ranges from 9 to 15 grams. A crucial and explicit warning: this herb is highly potent and inherently slightly toxic. It must only be used at the suggested therapeutic dose and should absolutely never be used during pregnancy, as it could pose significant risks. Overdose of black nightshade can lead to severe and dangerous symptoms, including headache, abdominal pain, diarrhea, and mydriasis, dilated pupils. Initially, there might be an increased heart rate, which is then followed by a dangerous slowing down of the heart rate, confusion, and ultimately coma. Tragically, cases of death in children have been reported from eating the uncooked, raw fruit of the plant due to its toxic alkaloid content. The presence of hemolytic alkaloids like solanine and solomargin underscores the critical need for extreme caution and strict professional supervision when using this powerful and potentially dangerous herb. The path of prudence, a message of hope and caution as we conclude this first part of our exploration into ancient herbs for modern cancer care. We have examined 6 powerful botanical allies: Aldenlandia, Lobelia, Scute barbata, Rhabdosia, Akebia quinata fruit, and black nightshade. Each of these herbs, deeply rooted in centuries of traditional Chinese medicine and increasingly illuminated by modern scientific research, offers unique and profound therapeutic properties, particularly in the complex and challenging context of cancer treatment. This series aims to provide a deeper understanding of these traditional remedies, bridging ancient wisdom with contemporary scientific findings. However, the recurring theme must be one of profound respect and caution. These are not simple, benign remedies. Their potency, and in some cases, inherent toxicity, necessitate a level of expertise and careful oversight that only qualified healthcare professionals can provide. The knowledge shared here is intended to inform and empower you, not to encourage self-treatment. Always remember that comprehensive cancer care involves a multidisciplinary approach, and herbal therapies should only ever be considered as a complementary modality, guided by experienced professionals. If this deep dive has provided you with valuable insights and sparked your curiosity, please consider giving this video a thumbs up, sharing it with others, and leaving a comment below. What aspects of these anti-cancer herbs did you find most compelling or surprising? Your engagement helps us continue to explore these vital topics. Thank you for joining us on this journey of discovery. Stay informed, stay safe, and join us next time for part 2 of Nature's Final Frontier, Ancient Herbs for Modern Cancer Care.